Hello, my name is Kathryn Tucker. I'm a registered dietitian and contractor to the Administration for Community Living. Welcome to the first event in our Food Insecurity Education series. Today's event will focus on collaboration as a tool to combat food insecurity. And considering where our country has been over the past couple of years because of the pandemic, as well as the changing communities of our nutrition program participants, it's clear that this must not only continue to be focus, but we start really ramping up our efforts. Next slide. By the end of today's webinar, you'll be able to understand how food insecurity affects older adults, identify components of the Older Americans Act and senior nutrition programs that help combat food insecurity, understand the importance of collaboration in combating food insecurity, and identify key stakeholders you can collaborate with to address food insecurity among seniors, and find ways to increase funding sources to help reach seniors who are food insecure. Additionally, at the end of this presentation, I will share resources that you can use to learn more about today's topic. The slides and the recording of today's presentation will be made available on the Nutrition and Aging Resource Center's website. Next slide. Our speaker today is Tim Getty. Tim, thanks so much for being here. And I'm going to give you a few minutes if you want to introduce yourself.
Thank you, Kathryn. As Kathryn so greatly introduced me, my name is Tim Getty, and I'm the Regional Nutrition Program Coordinator for the Heritage Area Agency on Aging based in Cedar Rapids, Iowa. And I've been in the position for 14 years, and one of my tasks in my day-to-day operations is developing nutrition innovations, modernization, and community collaborations within the nutrition program. And I'm just excited to be here and to participate with Kathryn and to provide as much knowledge to all of you to be successful in your programs in developing your programs for the future.
Thank you. Okay, so let's start. So we're going to start with what we know about food insecurity and how it affects older adults. The USDA defines food security as access by all people at all times to enough food for an active life. Food insecurity occurs when nutritionally adequate food and safe food are just not available. Next slide. There are two types of food insecurity. Those experiencing low food security have food, but it's nutritionally inadequate. This can lead to nutrient deficiencies and malnutrition. Those experiencing very low food security have reduced food availability. That can lead to skipping meals and not eating. And this type of food insecurity is serious and will lead to detrimental health conditions. Next slide. According to the USDA Household Food Security in the U.S. report in 2020, within the general population, 10.5% of the population was food insecure, which was about the same in 2019. And you had 3.9% households who had very low food security compared to the 4.1% in 2019. 21.7% of households in the South were food insecure. However, that was much higher than in any other region in the U.S., and this was an increase from 2019. Looking at the older adults specifically, 22.1% of older adults with low income who lived alone were food insecure. 12% of those were considered to have low food security, and 10.1% were considered to be had very low food security. That means that they did not have enough food. It wasn't just nutritionally adequate, it just wasn't there. Next slide. In 2019, the Healthy Aging Poll by the University of Michigan's Institute of Healthcare Policy and Innovation provided additional data on food insecurity among older adults, and it showed that 1 in 7 older adults were food insecure. Those 60 to 64 years old, the younger older adults, had higher rates of food insecurity than those 65 and older. The same poll found that food insecurity affected physical and mental health, and out of those who are food insecure, 45% had fair to poor physical health compared to 14% of those who are food secure. 24% had fair to poor mental health compared to only 5% of those who are food secure. And 43% had fair to poor diet compared to 20% of those who are food secure. Next slide. Let's take a step back and discuss what determines our health. 10 to 20% is determined by healthcare, 20 to 30% is determined by genetics, and 40 to 60% is determined by social and environmental behavioral factors. The last set of factors are collectively known as the social determinants of health, and they are conditions in the environment where people are born, live, learn, work, play, worship, and age. And these conditions affect a wide range of health risks and outcomes that determine the overall quality of life. Next slide. There are 5 domains of the social determinants of health, and they are economic stability. This can include things like poverty, income, employment, food insecurity, and not having enough food. Education, which includes factors like language proficiency, literacy levels, and graduation rates. Healthcare access and quality, which can include access to preventative medicine, dental care locations, accessibility to medical facilities, medical costs, insurance rates, and the health literacy levels. And you have neighborhood and built environments, which can include whether or not they have access to full service grocery stores, adequate transportation options, safety and crime rates, internet capabilities, water supply and quality, exposure to pollutants, and then the social and community context, which can include community cohesiveness, socialization opportunities, discrimination, and mental health. We know that the food insecurity is part of the economic stability determinant, and it's a critical issue that must be addressed. But how do we do that? The next slide. Decreasing the rate of food insecurity in our communities may be too big of a task to tackle in a short period of time. We can't do it in a day. We must take it step by step in order to make the progress to meet long-term results. So next slide. Where do we start? First, we don't want to start from scratch or on our own. Often there are food assistance programs already available within your communities, and your participants may not be aware of the programs, or they may be too overwhelmed to know where to start. And many of our participants are not really utilizing these programs to the best of their abilities or as much as they should. So by identifying what federal assistance programs are currently available, we avoid reinventing the wheel. Start by identifying the Older Americans Act services your organization already offers to help combat food insecurity. Connect with the Supplemental Nutrition Assistance Program or the SNAP office to find out who provides local outreach. And find out the Commodity Supplemental Food Program and the Senior Farmers Market Program, how they're handled, where, when they take place, and visit and observe. Identify ways your organization can improve utilization by existing programs by your participants. Could you help with SNAP outreach or general education? Could you do more to encourage participants to sign up? Could you communicate with these organizations by finding ways to partner? Next, we're going to dive into the programs proven to reduce food insecurity and improve health. But first, let's take a poll. It'll pop up in a minute. So what programs does your state have that help fight food insecurity? And you can go ahead and answer the questions. And we'll hopefully see some results in a minute. Aaron, when that's ready, you can there we go. So as we can see, we see that most of them, of course, noted SNAP, and we have other programs as well. But what we can see is we have areas where we can possibly start looking at to maybe help with these programs and utilize these a little bit more. Thank you. Okay, so let's move it along to the next slide. Of course, we're going to start with the Older Americans Act Nutrition Program. The intent of the Older Americans Act, as authorized by Title 3C, is to reduce hunger, food insecurity, and malnutrition, promote socialization, and promote health and well-being by assisting older adults in gaining access to nutrition, disease prevention, and health promotion services, and to delay the onset of adverse health conditions resulting from poor nutrition, health, and sedentary behavior. Next slide. The Older Americans Act program targets older adults who identify as being the greatest risk for food insecurity, and those include low income, members of minority community, it's those who live in rural communities, the limited English proficiency, and at risk for institutional care. And let's pause a minute and think about how many of these clients do we work with in these target populations. Maybe you serve more people from some of these groups than others, or maybe you serve quite a few from all of these groups. How can we reach these better? How can we do more to make sure that we're reaching those that we need to? Next slide. The Older Americans Act program are designed to promote the general health and well-being of older individuals, and the congregate and home delivered meal program provides meals to participants 5 or more days a week. And of course, we know that this is based on feasibility because some rural areas aren't always able to provide 5 meals a week, but we also have programs that provide breakfast or suppers. So it could look different in your area. Congregate meal settings where participants receive their meals together at a designated site help to reduce social isolation and encourage participation in other activities that can improve health outcomes. Home delivered meal programs provide those who are unable to go to the congregate center a nutritious meal and a connection to or a lifeline to people outside their home. In addition to providing meals, the Older Americans Act programs also provide nutrition screening. And this nutrition screening allows programs to identify areas of concern and to education topics, and it can also provide nutrition counseling for participants. Many senior nutrition programs also provide a variety of nutrition services into their programs. For example, you have nutrition supplements or food boxes, and I've even visited senior centers that have had their own food pantry and that worked entirely off of local donations where seniors can come in and pick up the items that they needed. Remember, it's up to individual states to make the determination on allowable programmatic activities that meet the goals of the Older Americans Act. Always refer to your state policies. Next slide. We've already defined the social determinants of health, but here we see how the Older Americans Act has and will continue to address the 5 domains as discussed earlier. If you look at the domains in the bold font, you will see examples of the Older Americans Act and examples of common referrals through the Older Americans Act that meet those domains. So for example, if you look at the economic stability domain, you will find meal programs and the community service employment programs as potential referrals. In the neighborhood built environment, you will find transportation and home services, home repair. In the social community context domain, you'll see things like telephone reassurance, caregiver programs, and virtual connections. Next slide. When working with seniors through the Older Americans Act, we must not forget about other programs that are proven to help reduce food insecurity and improve health outcomes. The Supplemental Nutrition Assistance Program, SNAP, is one of those programs. To qualify, the households must meet certain income requirements, but older adults can benefit from medical deductions, and this can help increase their benefits. SNAP provides monthly benefits that can be spent locally and online, and the Aging Network program staff can encourage and refer participants to apply for SNAP and help to dispel misconceptions about the program. Seniors could allow SNAP education agencies on site to help with applications. SNAP applications could be provided at commodity supplemental food program box pickup locations, and staff could even help seniors sign up while they wait in line. Participants can apply by phone or online, and these services, there are services that can help with the application process. But note, the states may vary in enrollment methods. You really want to check with your SNAP agency to see how they handle their applications. Next slide. There's also the Commodity Supplemental Food Program, and participants must meet certain income requirements, just like SNAP. The program distributes nutritious USDA food to people 60 years of age and older. The food provided contains good sources of nutrients that older adults are typically lacking in their diets, like calcium, iron, vitamin A, C, and D. They provide low sodium and heart healthy options, and the Aging Network program staff can encourage and refer participants, for example, by working with the Commodity Supplemental Food Program to help maybe have pickup locations at senior centers and congregate sites. Next slide. The Senior Farmers Market Program is available to low-income seniors, and it helps to increase access to locally grown vegetables, fruit, honey, and herbs. It increases domestic consumption of agricultural products to farmers markets, roadside stands, and community-supported agricultural programs. Some states even work with SNAP and collaborate between the SNAP and the Senior Farmers Market Program to have things called double up food bucks, which increases the purchasing power for their vouchers. And Aging Network program staff can encourage and refer participants to apply for the Senior Farmers Market Nutrition Program or help with applications. SNAP education staff often can help with applications by inviting the SNAP Ed local staff to provide education on the programs. It could be helpful, and it'll help introduce the availability of the programs to the participants. Let's take another quick poll. So, which program do you plan to reach out to first? Now, I know many of the areas already sort of work with most of these programs, but is there one that you could start working with more often? So go ahead and complete the poll, and we'll look to see what kind of changes we may be making. Okay, we should be getting answers up in just a couple of seconds. So it looks like it's pretty even across the board, but we're going to start really reaching out to the SNAP and the Senior Farmers Market Nutrition Program, probably a little bit more. So this is good to know. Okay, so now I'm going to turn this presentation over to Tim. Tim, I'm looking forward to listening about the importance of collaboration, and we can move to the next slide.
Great, thank you, Kathryn. So why collaborate in what we do? Working well within your organization is important, such as your team members and coworkers. However, not involving other outside organizations can really greatly reduce your program's impact. Strong partnerships improve the strength of the community, and there are also many benefits to collaboration, including eliminating duplication of efforts. This allows everyone to be effective and efficient in their efforts. And by pooling resources, you can also increase your impact to the community you serve, improving communication. Teamwork improves communication, which helps to build networks and friendships throughout the community in the work that you do. Avoiding burnout, which we're facing all of that right now. When a small group of people is always involved, they can end up being burned out. Having more people to help will energize your team and increase effectiveness and make the program reach a lot more. Increasing impact. Group initiatives can launch on a larger scale, which leads to a bigger impact and the chance to uncover opportunities that were not realized before the collaboration. Engaging stakeholders and funders. Policymakers are more willing to buy into a cause when numerous groups are working together towards the same goal. Collaborative efforts tend to be attractive to potential grant funders as well. That is a great option. Fostering long-term change. True collaboration fosters long-term social change, and I'll be talking a little bit about that in a few examples. Next slide, please. Collaboration, the key steps. To accomplish collaboration, we should consider key steps of success, including being territorial really limits your resources. By involving other organizations and their resources, you can increase the impact on the community. Make sure, though, that it's not a one-way street. Collaboration is always a two-way street. Find your champion. Each organization has at least one person that has a passion for a certain area of concern. That person may be passionate enough to encourage others to partner with your organization to meet common goals. And your champion could be a director or could even be a participant as well. Have clear goals and objectives that you would like to achieve in mind. Have clear goals and objectives that you'd like to keep in mind before meeting with organizations. This will help identify how they fit into a proposed plan. And always keep a record of what has been done, why, and how long. Making a timeline and list of resources can provide a guide to look back on for future endeavors. I know when I'm doing things, I always have to think, even just the other day, when did I do this? How did I do this? I had a question on how we implemented something 4 years ago, and I had to think back. Invite other organizations to visit your program and make time to visit theirs. Be open to outside help. Enlisting a specialist in food insecurity or other topics can provide with technical assistance and help reach your goals. Any potential partners would want to know how their partnership makes a difference. Collecting data and sharing information lets them know they are part of the bigger picture, making sure we do our homework. Share comments and stories from participants to make a bigger and more lasting impact. And lastly, begin the process of establishing collaborations before they are needed, such as for grant opportunities, during emergencies, things of that nature. And I cannot stress that enough. Next slide, please. Potential key stakeholders. This is not meant to be a complete list by any means, as numerous organizations can collaborate with senior nutrition programs. Each community has their own unique resources that can lead to collaboration. Go to community meetings, educate people about your programs, and invite other community-based organizations to do the same.
And we're going to do a quick poll. How many of these activities do you currently partner with? So they include hunger organizations, coalitions, and task force, food pantries, feeding centers, schools, the cooperative extension agencies, faith-based organizations, grocery stores, farmers markets, hospitals, tribal food programs, and local governments. And you can click as many as you want. So I would just like to see what people are already partnering with. Okay, they should be coming up here soon. Here we go. Okay, it looks like food pantries, of course, but we have some other areas that we might find a little bit more availability. Maybe we can start partnering more with some of these others. So I'm going to turn it back over to you, Tim, and you can continue.
Okay. Thanks again, Kathryn. And next slide, please. And hunger organizations and task forces and coalitions, and of course, many of these are very well known. You can also find partners for collaborations outside of the Aging Network. Keep track of other organizations you can partner with to help increase resources, also share resources, learn about local, regional, and state efforts to address food insecurity, such as hunger organizations, task forces, and coalitions. When reaching out to them, though, consider the following, such as having a representative attend local programs to learn about activities and share key information. Although we have hunger in every age category, recommend the aging population be part of a group or an organization's mission. Referred participants, if an organization has food distribution options or other resources other than yours, for example, some of the organizations would be willing to do the same for your program, more of a cross referral. Develop a resource list from your area and share it with any organization you connect with. This proactively avoids duplicate efforts and brings in appropriate stakeholders and ultimately optimizes the service we are providing to our consumers. Next slide, please. And I know sometimes working with local government seems like a Herculean task, but you can also look for collaboration opportunities with your local government. And I'm talking, of course, fiscally, but also as a collaboration, not necessarily with income. Partner with specific departments like the Parks and Rec departments, planning and development. Be ready to present them with information on programs and partnership ideas. I know Kathryn has talked about the use of data and information in partnerships. Educate staff on your program so it's available. You'd be surprised how many people still don't realize that home delivered meals are available. Highlight benefits and use those statistics. Reach out to your elected officials as a constituent. Develop a relationship before asking for funding. And look for ways that the government can partner without funds, such as buildings, marketing assistance, volunteers, things of that nature. Next slide, please. We could talk about some examples. These are just some of the examples. The first slide is an example, a very quick example of working with a local government. In Eastern Iowa, we're based in Cedar Rapids, Iowa, and the metro area is made up of many different suburban areas, one of them being the city of Marion. And very long story short, we applied for, in conjunction with the Iowa Department on Aging, we collaborated, again, collaborating with the state government, and we collaborated to receive an administration on community living grant to implement some new innovative service delivery models for a congregate meals, where we opened pop-up cafes. And we collaborated with the city of Marion. We asked them, could we use one of their park areas? And lo and behold, I'll never forget that time, the meeting with the mayor and the group of different senior service organizations in the area. The mayor, Mayor Nick, he's one of those very progressive, saying, okay, you can have one, but why could we have more? What else can we do? We've taken it from just an idea to opening up. We're now looking at an entire brand throughout Eastern Iowa. And with the city of Marion's assistance, not only are they letting us just use a park building, we will be reopening a pop-up cafe in the Marion Public Library once that reopens. And then also they have taken a step further. The city has purchased, and you can see that there, billboards for their programs, and they consider the Encore Cafe concept as a partnership with the city of Marion. So our program was gifted the use of billboards. They have taken over all of our marketing efforts in the Parks and Recreation guides. We are in there. We're in their monthly e-news blasts, all of the above. And we do not currently ask for any monetary assistance, because in meeting with our team, we have decided we would be just using those funds to supplant what we're doing now. So their in-kind really is their contribution. And we were also named by the mayor in 2020 as one of the top successes in the city of Marion. So the next example is, which is really brand new since March, that is what's called our produce pantries. It's part of our Encore Essentials program. That is a collaboration with our local food pantry, HACAP. And that is when we were talking about collaborating with hunger relief organizations. I have the privilege to being on the advisory board for the food reservoir as their representative that represents the interests of older Americans, or older Iowans. And then also what we do is we've partnered where they bring out produce, fresh produce, great produce out, especially out to the rural areas once a month. We are a dedicated food produce distribution with some dairy products as well on a monthly basis, mostly to the rural senior dining locations. And then also, when you said we talk about local governments and hunger relief organizations, we also talked about organizations you would never think of. The third of the last picture is one of our food distributions. You could kind of see it, a bunch of the volunteers and that black van. We actually partnered with a local hotel right during the onslaught of the pandemic. And the hotel not only donated the use of their van, because we weren't set up for that normally, they donated all their leftover food since their facilities were shut down. And they were also, before everyone went on layoff, they actually paid their staff to come volunteer at both of our food distributions once a week. So that was great collaborations. And again, we always never know what the needs are or what your possibilities are. Okay. Excuse me here. Okay.
All right.
And then I will turn that back over to Kathryn.
Thank you, Tim. That was so much. I mean, you all have done so much, and the collaboration is really just never ending. You can always find a new area to collaborate in.
Thank you.
So let's move into the tribal communities. The Administration for Community Living encourages states and the area agencies on aging to ensure services are reaching older adults in the greatest social need, including individuals who are Indigenous, American Indian, and Alaska Native. The quick guide to the Title III, Title VI nutrition collaboration has suggestions for starting and maintaining collaboration with the Title VI programs in your state, AAA, and local areas. The link to this resource can be found at the end of this presentation, and this guide includes information on the following topics. It'll talk about planning for collaboration, which is understanding each tribe has different rules and regulations, and no two tribes are the same, and incorporating cultural competency into your organization. It'll talk about implementing collaboration, which is deciding which tribe you want to work with and which are open to working with you. And you may want to consider someone who has the greatest need. Maintaining collaboration is also included, and this helps to establish a consistent point of contact. And you want to meet often to build trust, and remember that collaboration takes time, so don't give up if it's really slow at first. So next slide. You can also help combat food insecurity by finding ways to increase resources available to your programs. Volunteers are critical parts for executing the Older Americans Act program, especially the Senior Nutrition Program. Volunteers allow programs to save money on staff and spend it on serving more participants, which in turn helps combat food insecurity. But we know that there are shortages for volunteers. We know that most of the volunteers that were available before were our aging participants, and they're just not coming back out to volunteer like they were before. But now is a time to look for other opportunities for volunteers. Be creative. If your community has a lot of folks who are still working, look at offering home delivered dinners instead of lunches. Maybe we could get volunteers to help deliver the suppers. Include high school and college students as volunteers. This can open up a whole new opportunity for your programs. Many colleges, especially the fraternities and sororities, really focus on community service, and they have large groups of people that may be able to schedule different days to come in and volunteer. Just start the conversation. A lot of your high school students, especially your seniors that are getting ready to graduate, often may leave half days, and they may be able to volunteer during lunchtime. And they also need community service hours for scholarship applications. So those are just a couple of people to look for. There are several ways that people can volunteer to support the Senior Nutrition Program. They can assist with food delivery with serving at the congregate site. They can help with transportation and grocery shopping and deliveries. They can donate or collect items for food drives or shelf-stable meal kits. Kentucky AAA has utilized Health Occupation Students of America from a local high school as volunteers for telephone reassurance. And at one AAA that did this, a young man volunteered to conduct telephone reassurance on an older gentleman. When the young man graduated, he insisted on being part of the interview for interviewing the person that took over. He wanted to make sure that his person was very well taken care of. The relationship that was built was intergenerational, and it made a positive impact on both of them. Ohio State University has a program where they collaborate with college food service programs for a nutrition provider for the Older Americans Act. And they have the history students come in and meet with the older adults at lunch. They say the connection with some of the military veterans and the students have been amazing. Next slide. Fundraising may seem stressful, but it can be a terrific way to help your organization serve more seniors in your community. And here are a few creative ideas to get you started. Adapt and adopt a senior model to meet your program needs. They can look different in every area, so make it yours. They could cover the cost of meals for participants in the program's waiting list. They can cover the cost of someone already receiving a meal. They can provide produce or local food products to add to the meals. Fundraising and meal galas, you can invite local government officials to learn about the program and receive a meal. You can ask for donations or charge per plate to raise funds and educate them on the needs of the program. Charity runs and car shows. You can do entry fees, and that can go to the nutrition provider to increase the number of meals they serve. You can have the car shows right there at the senior center, and it could be an activity as well. Auctions, providers can maybe receive donations from local businesses to conduct silent auctions, and you can even put these up on social media. You can ask local golf courses or country clubs if they can organize an event benefit for your program. You can ask participants to bring in old or gently used books or make crafts, and you can sell at events. And there was a program that I'd heard, it was the holiday cards. You can have people, for example, sell a holiday card for $5, and the purchaser can write a note to a home delivery meal participant who will receive the card along with the holiday meal. It helps pay for the meal, and you can do this for numerous occasions. It's not limited to just the holidays. Next slide. ACL's Nutrition and Aging Resource Center's website has numerous resources for senior nutrition program providers, including tip sheets, guides, and more. And many of the links that are available at the end of this slide deck are resources that you can find at the Resource Center. They also have a whole section for consumer information that could be used to provide to participants. Next slide. So we have covered a lot of information today. And just know when community organizations work together, it increases the effectiveness of their efforts and helps them reach their shared goal. As I end the presentation today, I encourage each of you to take at least one of these next steps toward addressing food insecurity in your community through a collaboration. Find your champion. Let them lead the charge. It could be anyone. Be a consistent voice on local councils and coalitions. If you don't attend, your voice is not heard. Invite different stakeholders to your events and go to theirs. Make sure it's not a one-way street. Strong partners help each other. So offer your help where you can. Be an active voice on social media. This is to ensure the community is aware of programs available to them, and many older adults are starting to really rely on social media to keep up with current events. Next slide. So I hope you will participate in the future events on this important topic. We are aiming to focus on these topics, and we look forward to announcing more information soon. So the next webinar will focus on the State Unit on Aging, promising practices for combating food insecurity. Then we will go into how to identify and screen participants for food insecurity. And then we will go into identifying and referring participants who are food insecure. Next slide. So I want to open up the questions. If you will look down at your Q&A, you are more than welcome to put some questions into that function, and it's going to be at the bottom of your screen. And we also have an evaluation, and I was wanting to see if we were able to put that in the Q&A. We will, let me see. Okay, we have some questions that we can put in. I'm going to open those questions up in just a minute. There will be a Survey Monkey that will go out on the webinar, and I'm going to see if I can't get that put in there when we start the questions. Feel free to ask a question about community-based organizations that we didn't mention. And if you found other ways to collaborate, feel free to share. And if you've met some roadblocks, you can bring those up as well. And if you don't feel comfortable asking questions today, you can always email Tim or myself, and we'll be happy to answer any questions whatsoever. So let me see if I can get this copied.
Kathryn, we do have one question, and
Okay.
they're looking for whether maybe Tim or other audience members might have a response to this. Wondering how you plan on continuing hotel partnerships now that the worst of COVID is behind us, hopefully, and now that hotels have reopened and need to make profits.
Great
So for any of
question.
you or the audience.
I can take that for you, Judy. A great example would be hotels. I also see them pretty much as restaurants, any of them, regardless of COVID or whatnot. We talk with them about any of their surplus items that they have that are left over. Say, for instance, they have a large event and they have to order 6 number 10 cans and they only end up using 4, and then they have 2 sitting on the shelf. What do they do with it? Instead of throwing it away, or they had a large party that involved lasagna, and they had 6 lasagnas. They served 6 lasagnas, but they had 10 left, and those weren't served yet, but they followed all food safety practices. I would say make initial contacts with the hotels and things of that nature. Any of your food service establishments, just to see. You would think, well, a lot of people have already asked. I thought that too, being in the Cedar Rapids metro, the second largest metro area in the state. And you'd be amazed how many untapped resources there are. I mean, it's just astonishing where it's like, wait a minute, you'll come by once a week to pick something up, or I've been called, hey, we have this large event, this food hasn't been served, can you use it? It's like, sure, we can. I mean, we won't obviously put it through as an Older Americans Act meal, but it would be an additional supplement for weekends or something like that. I think we're really donations right now, for instance, monetary donations is really tough, really across the board. But for those, I mean, you're helping, for instance, we pick up twice a week at a couple of higher end gas stations that pretty much work as a grocery store too. And we pick a lot of things up. It's just amazing what we get. I picked up sirloin steaks and ribeye steaks the other day that had 1 day left, and they're just going to throw them out. So then instead of them spending money on their recycling fees or their disposal fees, they donate to us and they go to at-risk older adults. And we use that as a part of our care team, case management, and elder rights support services.
Excellent, thank you. We have another question that just came in. I might be able to help with one response, but Tim and Kathryn, please feel free to fill in. It says, I'm a community-based organization that does not offer food programs beyond an emergency food pantry. I guess I'm wondering how to engage with food programs like the Older Americans Act, et cetera. And certainly one resource you can go to is the Elder Care Locator. It's easy to just type that in, Elder Care Locator. It's sponsored by ACL, Administration for Community Living, and it will help you find the local senior nutrition program and many other resources in your area. But Tim or Kathryn, feel free to add to that. In your area, where might someone go to connect with an Older Americans Act program?
I can take that real quick. I actually get phone calls about this very topic quite frequently about how do I partner, who is my local provider, Heritage Area Agency on Aging. We subcontract all the production and service of the meals. So I would say reaching out to your local area agency on aging, and then they would have a list of who to partner with. Things of that nature. Also, United Way would have it. I would also just surf the internet, senior nutrition programs in the area, things of that nature. You'd be amazed what you can get. Or your local government may have a community services division, like our county, Lynn County does, and they have a list of more information than you're ever going to need on different organizations. I've been here 14 years, and every time that comes out, it's like, oh, I didn't know they existed, and they've been here that long.
Wonderful. Well, here's something, Tim, that I think you could be very helpful in responding to, and also audience members may want to chat in their responses, because I think this is on everyone's mind, which is that COVID exacerbated senior isolation, and that, along with innate mobility challenges, make it hard for seniors to attend events, markets, food distribution, and more. Any ideas how to entice and or increase senior attendance?
I would say make it appealing. How I really go to is, and that's a wide answer. There also is their return. They're investing their time and energy, just like going to a restaurant. Well, if my service is and the food is okay, are you going to go there multiple times? Find it as a destination. Maintain as you're a nonprofit, but think like you are for profit, if that makes sense. Is this food appealing? Would you eat it? The days of just putting the food on a styrofoam plate, maybe putting some gravy on it, serving it at 11:30 and clearing the plates at 11:45. Older adults these days do not want that. They want engaged. They want it to be a destination. Talking about bringing people into congregate sites, what we have really talked about in talking about COVID is we are seeing a substantial increase in participation in congregate sites in our region, not just our pop-up cafes, but across the board. What we're starting to hear, especially in the rural communities, is we're a safe place where we follow protocols, we follow we're known as, we know what we're doing, they're comfortable with us. So it's like, you know what, instead of going here and there, we're gonna go to the local senior dining site. That was not anticipated, and it was, oh, okay, well, we're going to have to do it this way, which is great. I mean, it's a great way, it's changing things. We're increasing the congregate participation without really having to do much. It's been crazy.
Congratulations on that. Your trusted relationship with older adults in your area really comes through. To bring them into the congregate sites and other services that are offered. So that's so great to hear about. I know that Aaron at the Resource Center might be able to see the chat, and I'm not sure if there are questions that are coming in over there.
I think there was an issue. Oh, go ahead.
Yeah, I don't, I believe, please forgive us, I'm still trying to figure out this Zoom situation. I believe that attendees can only communicate with us as panelists and moderators, and I have not seen anything in the chat.
Perfect.
So if you would continue to just use the Q&A function, that's the easiest for us to monitor. I am going to go ahead and try to drop in the chat for everybody, though, the registration for the post-conference survey. So if you can access that, fantastic. If you can't, I'm so sorry. We're going to find a way to get it to you. So thanks for your patience.
Tim, your Encore Cafe, you brought it up. You talked about a few elements of it, but would you mind sharing a little bit more with the audience, because it's really special?
Mm-hmm. It's very interesting because, as I said before the webinar started, I'm actually going to be meeting with the health inspector, and we're opening our last Encore Cafe. Actually, that was destroyed in the 2020 derecho. So we're getting ready to reopen there. What the cafes are, they are pop-up cafes in parks and rec departments, churches, public libraries. We've actually expanded and now we're offering what's called Encore Express down in Washington County, which is not as big. It's kind of like, we call it Encore Cafe Light, if you will. But we offer, we serve in certain areas, certain days of the week, 11:30 to 12:30, and they could come as whenever in between that window. We partner with a local grocery store chain to help cater our meals. They're all, and everything meets the Older Americans Act guidelines put forth through the State Unit on Aging. Then we also work with the health department. And I didn't mention them, but I should say we really want to look at also working with your public health department. I know sometimes they get a bad rap, but I know in Linn County, we deal with 6 different ones in our region. But Linn County is, I cannot believe how big of an advocate they are. They actually asked us to be on their advisory committee as well, because they weren't really sure of older adults and things like that. So you never know. So what it does is we opened it up. We also offer a salad bar. Suggested donation is $5 per person. That's, again, suggested. And then we have fun. Everything is on, now that we've kind of relaxed some COVID restrictions. Everything is reusable plates, reusable silverware. And this is all from our volunteers. We don't have giant coffee pots that look like back in the 80s, the missiles, as I call them. You pour the volunteers pour the coffee, they pour iced tea, they basically bust the tables. There's no lining up to the dish room, things of that nature. We have many, many volunteers. We have activities. We're just starting ramping back up activities. We had local law enforcement do safety presentations, scams. We have disaster preparedness coming up. We'll be doing some Tai Chi, things of that nature. We have the local YMCA with an older adult bike program that they could rent bikes from the YMCA, driving, pedaling around, things like that. So we want to make it a destination. And again, we also provide them with the meal, but then additional resources. Like today, one of the sites we did a monthly food distribution in conjunction with the local food bank. We do the senior farmers market checks distributions, things like that. We have dedicated logos, we have dedicated colors, we're branded, things of that nature.
That's wonderful. We did get a few questions that came in throughout the webinar about eligibility requirements for SNAP and other programs. And we do have a lot of resources on the Nutrition and Aging resource website that you can go to. And to find out more about Tim's Encore Cafe and more, go to the Resource Center's website. His program and others that are really innovating and moving things forward is on innovation models. You'll see that tab on the website. So definitely go in to the Nutrition and Aging resource website. And we'll also be showing you a few resources, I believe, at the very end of the presentation.
Yes, and the webinar evaluation is in the chat, and you can see that. So if you can complete that, that would be great, because this will help us also plan the next 3 webinars to ensure that we are giving you the information that you need. And if you can go to the next slide. Here you will see these are some of the resources that you'll find helpful to your efforts to address food insecurity. Again, the PowerPoint from today's presentation will be available, so you can also follow the links. But they have a lot of this information is on the Nutrition and Aging Resource Center, as well as USDA information, CDC. We have the Food Research and Action Center, Feeding America, Defeat Malnutrition Today, and some other areas of malnutrition that is available in the links.
A couple more questions came in.
Yeah,
they're coming in.
Awesome.
So add the websites that were mentioned to connect with local resources, please, into the chat. And as we mentioned, that might be a little bit difficult technically, but you can go to the elder care locator and just put that into your search engine. I think it's eldercarelocator.acl.gov, if I believe, and you can find just a myriad resources there. Tim, I'm not sure if Tim might have had to leave, but wondering about meal delivery and use of volunteers and best practices in recruiting. So that's an excellent question. Unfortunately, Tim did have to leave right now, but I'm going to do another plug for the Nutrition and Resource Center, the Nutrition and Aging Resource Center, because there are many good best practices for recruiting volunteers. We'd love to hear from those of you in the audience that are finding effective ways to recruit. And I do believe, Kathryn, when you were talking about partnerships, that those are also some really excellent examples for how to recruit partners,
Yes.
volunteers, excuse me.
Yeah, right now, I mean, where most of the volunteers were aging adults, and now, I mean, we really have to sort of start looking outside of that box and getting some different ages and going to colleges. They are very community service oriented, and there's a whole generation that really is looking for something to do in the community service. So now's the time to really start reaching out to colleges, reaching out. I mean, you may be able to put stuff up at coffee shops or other areas where a lot of the younger population probably hang out or congregate, and you will probably find volunteers in that area. It's not going to be easy at first, and it's just going to be starting the conversation. But what we have found is that college students in particular, a lot of your like Greek communities, your fraternity and sorority communities, they are very heavily community service oriented, and they want to be a part of something. And as well as high school seniors. We have several that have even come to me and asked about volunteering at the local senior center. So that way they could get some community service, and they wanted to do something in the community. And it's just a great way. And, you know, high school students may not always be easy, but they are, I have three high school, 3 teenagers. So, but they are community oriented, and they want to do things. So it's a great way to start.
Super. We got another question about will the slides be available via email? And I think also, you know, I've been mentioning the Nutrition Resource Center. Perhaps that link could be put into the chat just for ease of use of the audience. We have a couple more that came in while we have a couple last minutes. They say ditto on reaching out to colleagues, high schools. Also, work from home community have been a great source. People are looking to get out of the house for an hour or two for a change of scenery, keeping the volunteering opportunity short versus having to commit a full day has been an approach that they've used. Let's see, another one is utilizing CSEP, the Senior Community Service and Employment Program for workers is another suggestion. And opportunities posted on justserve.org. If you'd like to post your opportunities, there's a recommendation from an audience member on justserve.org. That's a suggestion. So thank you for all of the comments coming in from the audience. So we'll have one last minute or so for any last questions that you'd like to pose through the Q&A. Otherwise, I think we're getting a lot of positive responses. Kathryn, I want to thank you and of course, Tim, for being here today. It's really been a terrific presentation, lots of good ideas, and folks are commenting about how many great ideas that this presentation has shared.
Thank you. This is fun. And I really want to thank Tim, and I know he had to step away. He's actually getting a new nutrition provider approved. So it's very important work, and his job never stops. So I just commend him, and he does so much. And many of you do, many of you that's on this call, you are fighting this fight. And sometimes it's just thinking about something a little differently. And when we get ideas from other people, we can do more. So this has been fun.
There's one last question about getting a
Yay.
transcript, and the transcript will be available along with the slides and the recording on the Nutrition Resource Center website. There we go. And that is posted in the chat.
Yes.
All right.
Okay. I think we are at time, and I want to thank everybody for attending. Please look out for the next webinars that will be coming up. And we're happy to have you here today. I hope to see you again, and I hope you enjoy the rest of your day. Thank you, Judy, for all your help.